Sheehan syndrome is a rare condition. It affects new mothers. It happens after severe blood loss during childbirth. This blood loss can starve the pituitary gland of oxygen. The pituitary gland is vital. It's located at the base of the brain. It's often called the master gland. It controls many hormones in our body. When the pituitary gland doesn't get enough oxygen, it can become damaged. This damage disrupts the production of essential hormones. This disruption leads to Sheehan syndrome. The pituitary gland is responsible for many hormones. These hormones control growth, metabolism, and fertility. One crucial hormone is prolactin. Prolactin stimulates breast milk production. Another critical hormone is thyroid-stimulating hormone, or TSH. TSH regulates the thyroid gland. The thyroid gland is essential for metabolism. When the pituitary gland is damaged, it can't produce these hormones effectively. This lack of hormones leads to various symptoms. These symptoms can be vague at first, making diagnosis tricky. Symptoms of Sheehan syndrome often develop gradually, making it difficult to identify early on. They can be mistaken for other postpartum issues, such as general fatigue or stress. One common symptom is the inability to breastfeed or produce enough breast milk, which can be distressing for new mothers. This is due to the lack of prolactin, a hormone essential for milk production. Other symptoms include persistent fatigue, unexplained weight gain, and significant hair loss. These symptoms are caused by low levels of thyroid hormone, which can affect overall metabolism. Some women experience irregular or completely absent periods, adding to their stress. This is due to the impact on reproductive hormones, which can disrupt the menstrual cycle. It's crucial to seek medical attention if you experience these symptoms after childbirth, as early intervention can make a significant difference. Early diagnosis is essential for effective management of Sheehan syndrome, allowing for better quality of life and health outcomes. Section 4. Diagnosing Sheehan syndrome. A closer look. In this section, we will delve deeper into the diagnostic process. Diagnosing Sheehan syndrome involves a combination of assessments, each playing a crucial role in identifying the condition. Doctors will first ask about your medical history, focusing on any past health issues and symptoms. They will specifically inquire about any complications during childbirth, such as severe bleeding or low blood pressure. Blood tests are crucial for measuring hormone levels, providing essential data for diagnosis. Low levels of pituitary hormones, especially prolactin, can indicate Sheehan syndrome, pointing to potential pituitary damage. Imaging tests, such as an MRI, can reveal damage to the pituitary gland, offering a visual confirmation. Diagnosing Sheehan syndrome can be challenging due to its subtle and varied symptoms. Its symptoms mimic other conditions, making it difficult to pinpoint without thorough investigation. A thorough evaluation is necessary to confirm the diagnosis, involving multiple tests and expert consultations to ensure accuracy. Section 5. Treating Sheehan syndrome, hormone replacement therapy. Treating Sheehan syndrome involves replenishing the missing hormones that the body can no longer produce on its own. This is typically achieved through hormone replacement therapy, which can be administered in various forms such as pills, injections, or patches. This therapy helps manage symptoms and significantly improve the quality of life for those affected by Sheehan syndrome. Corticosteroids may be prescribed to replace cortisol, a vital hormone for stress response and metabolism. Levothyroxine is used to supplement thyroid hormone, which is essential for regulating metabolism and energy levels. Women may need estrogen and progesterone to regulate menstrual cycles, maintain bone health, and support overall reproductive health. The dosage of hormones is carefully tailored to each individual's specific needs, ensuring optimal effectiveness and minimal side effects. Regular monitoring through blood tests is crucial to ensure the effectiveness of the treatment and to make any necessary adjustments. With proper management and regular follow-ups, women with Sheehan syndrome can lead healthy, fulfilling lives, enjoying a good quality of life. Section 6. Managing pregnancy with Sheehan syndrome. Sheehan syndrome can impact future pregnancies. Women with this condition may experience difficulties conceiving. They may also require specialized care throughout pregnancy. Close monitoring of hormone levels is crucial. Adjustments to hormone replacement therapy may be necessary. It's essential to work closely with an endocrinologist. An endocrinologist specializes in hormone disorders. Pregnancy with Sheehan syndrome can be managed effectively with proper care. Open communication with your healthcare provider is vital for a healthy pregnancy.